Welcome to part 2 of 4 in the series Resiliency. This presentation is prepared by Dr. Karen Semmons, a faculty member from the College of Nursing and Professional Disciplines at the University of North Dakota. This first presentation focuses on how to assess and identify stressors. There is an optional resiliency quiz at the end of the presentation from the Resiliency Center. The link to the quiz is found on the reference slide number 10. The objectives for this presentation are to 1. Identify stressors in the workplace that may be caused by the environment and work conditions, and 2. Identify stressors in the workplace that may be caused by the healthcare team and clients. In review, resiliency is the ability to bounce back from adversity. There are things in our workplace that can cause stress and affect our ability to be resilient. This presentation will identify some of those stressors that make us less resilient. Let's start with stressors identified in the workplace in regard to environment and work conditions. There are 5 potential causes of workplace stress. They are unrealistic timelines, workload, lack of communication, the workplace environment, and the relationship between employee and supervisor. Notice how the 5 potential causes of workplace stress relates to the environment and work conditions. Let's start with timelines and workloads. Timelines and workloads often go hand in hand. Having unrealistic expectations of the amount of work to complete in the time allotted is one of the main reasons for stress in the workplace. Too high of a workload and not enough time to complete the tasks in healthcare can lead to medical errors. Those errors can be minor, major, or even life-threatening. Decreased job satisfaction may occur if someone feels that their performance is substandard because they did not have enough time to complete the task. Not having enough to do can also create stress and decrease job satisfaction if someone feels that they are underutilized. How often do we hear in the workplace that there is lack of communication? Communication among team members is vital to a smooth-running work environment. Team members need to feel comfortable communicating with each other and the supervisor. A poor relationship with a supervisor can lead to negative communication or no communication. Supervisors can be rude or difficult to work with. There is a common saying that employees don't leave their jobs, they leave their supervisors. The 5th element of stress in the environment and work conditions is the physical environment itself. Is the workplace too hot or too cold? Is the physical area too cramped to work in that prevents the employee from adequately performing the required tasks? Now let's look at some of the stressors in the workplace caused by team workers and the clients we care for. Understaffing, lack of resources, workplace violence, and dealing with loss. Some of these stressors are similar to the stressors in the environment and workplace. Understaffing and too heavy workloads without enough time to complete the tasks. Having to be able to multitask and having frequent interruptions while conducting tasks adds to the stress level. Another stressful factor can be lack of resources, not having enough supplies to complete the task, or not having the right kind of training to do the job. A major problem in healthcare can be workplace violence. This can be from challenging clients, their families, relatives, significant others, and/or friends. Most healthcare violence occurs in nursing homes and hospitals. A bill was introduced on April 13, 2023, to protect hospital personnel from violence. It is titled the SAVE Act, Safety from Violence for Healthcare Employees Act. Another stressor that isn't always thought about in healthcare is dealing with the loss of a client. Either an expected loss or a traumatic event that leads to a loss. Often after a death of a client, the employee must go back to work to finish the shift. Let's put some of these stressors into a scenario. You are working as a CNA in a nursing home. You're in resident A's room, getting the resident ready for the day. The charge nurse comes in and says, "Oh, I forgot to tell you that resident B's family is coming to take her out for the day, and you have 30 minutes to get resident B bathed, dressed, and fed before the family comes." You know it takes at least 60 minutes to get resident B ready for the day if doing it by yourself. However, if you have help, you can get it done in the time allotted. You try to talk to the charge nurse, and she tells you she doesn't have time to talk to you about it, just get it done. You finish with resident A, and you now have 20 minutes to prepare the other resident. You see your supervisor in the hallway, and you try to talk to her about having someone come to help you. Your supervisor tells you, "It's your job, figure it out." You walk into Resident B's room, and she has clothes scattered throughout the room. You cannot find a clean outfit for her to wear. Her room is so cluttered that you can't get the mechanical lift into the room to get her out of bed and into a shower chair. So you decide to lift her alone, because there is no one to help you. While lifting her, you feel a strain in your back, but you ignore it because you don't have time to worry about it. You get your resident showered and dressed. Because Resident B does not like to be rushed, she was scratching and hitting out during her shower. While feeding her, the resident spills her juice on her pants just as the family walks in. You haven't had time to change the pants or do the resident's hair and makeup like the resident wants and her family expects. You overhear the family complain to the charge nurse that you are an inadequate CNA, and they don't want you to care for their mother anymore, even though you have been Resident B's primary caregiver for 2 years and have never had a problem with the family before. Some of the stressors identified in the scenario are timelines, workload, communication, relationship with the supervisor, environmental space, lack of resources, and workplace violence. Could the scenario have had a better outcome? Absolutely. Communication could have been better among the charge nurse and CNA. The supervisor could have asked how to help. The family could be told that 30 minutes was not a reasonable time. If the CNA had the proper time to complete the tasks and the resources available, she may not have hurt her back or been scratched and hit. Resident B would have been presentable to the family, and the family would not have been frustrated. This concludes this portion of Resiliency. Part 3 will focus on self-resiliency and how to improve our own resilience. If you are interested in taking the Resiliency quiz, it is on the following reference slide. Thank you. These are the references used for this presentation and your further reading.